So I'm going to show you how to do the admission as a provider from the emergency department. So this is, you've seen the patient in the emerge, you've done all your diagnostics, and the decision to admit has been made. And you want to put forward the admission orders. So on your tracker, you're going to see your patient. So we've got our patient selected. Your tracker may look like this if you've got the expanded views, or it may look like this. Either or will be fine. So you're going to go ahead and highlight the patient that you're working with, which in this case is our QEL test Amanda. And then we're going to go to our orders tab up here, and we're going to click on that orders tab. Now we're going to go to the transfer admit tab over here on the right side, and we're going to click on that. So the first thing we need to do is we need to decide where the patient is going. So we're going to click on this drop down here, and we're going to go ahead and select Combined Med-Surg in this particular case, and that's where we're going to send the patient. Now, in the emergency department, very likely that the nurses will have already queued up the patient's own medications and done the reconciliation or the verification of those medications on their end. So you now, as the provider, need to decide, do you want to continue these medications or do you not want to continue them? So if you want to continue or hold them, you'll just click continue or hold. If you want to make a change to the dosing on these medications, so what you need to do is you want to make sure that you click on continue first. Once you have continued the medication, you then can go ahead and click within the dosage and change the dose value inside of this window. You won't be able to adjust the dose from here. So now that we've carried over the medications that the patient's already on, we're going to want to add our admission orders to this patient. So we're going to click on this add new button, and this is where we're going to add an admission order. So I suggest putting in the word admit into the search engine, and that will automatically bring up a whole plethora of order sets relating to various diagnoses. So you can select any one of these, and they will be basically standards of care that are built around those diagnoses. If you don't want to go that way, then you can just choose a generic admit to med-surg or admit to critical care and add the pieces that you want to add on your own. So in this case, we're going to click on the admit to med-surg. And when we do that, so the very first thing it's going to ask us is who the provider is. So in this case, I am acting as Tim DiBertoli, so I'm going to indicate that I'm the provider, the attending provider. And then I need an admission diagnosis. So here we're just going to say that the patient's being admitted with sepsis. So isolation statuses. Isolation status is an order from the physician side. If you're not sure what to put here as a provider, you can leave this unchecked, and either infection control or nursing will deal with the isolation piece. If you do know ahead of time that the patient is going to be a routine precaution, whatever, it's advantageous to select it right away and get that done and over with. So you're also going to notice that there's all automatically triggered an MRSA VRE swab for the patient. So we're going to let that be. For diets, so it automatically selects a regular diet, but you can deselect that and select another diet if that's what you choose to do. Oxygen needs can be dealt with as an as required piece here. You can add IV solutions as well, so you can do a bolus IV or you can do a maintenance IV if you want on this particular patient. So we can go ahead and select something from the list there. We can also change that rate to something else if we'd like to change that rate to something else. For it, we have opioid analgesics that we can select from here. So the VTE prophylaxis piece. So if we choose that this patient needs VTE prophylaxis, then we would skip this not required part, and we would go on and select anti-embolytic stockings and what dose of enoxaparin, which should be triggered based on the patient's weight entered into the system. If we don't feel that that's needed, we can select this not required piece and deal with it from there. And then you can also put forward some lab orders for your patient for the morning. And those will get dealt with when the patient has blood work in the morning. And then some of these things will trigger a, I'm going to leave that blank to show you what it does. So some of the orders do have required fields, and I'll show you what those look like thereafter. Um, I do want to show you, I kind of skipped over it. So you do have this physician handover portion of your admission set that you may choose to use or not. If you're keeping the patient yourself and you're going to be MRP, you don't need to do this. If you're going to hand over the patient, then you are going to want to deal with this routine as well. So either you're going to be handing over to the MRP or a consulting physician, or a specific physician if you want to choose that as well. So the MRP here, you're going to choose which the doctor you've spoken to or which doctor is designated MRP. In this case, we'll just say it's Dr. Groh. And then this will automatically default to tomorrow morning as the transfer of accountability piece. You can change this to another date if you choose to or another time. Obviously, we're defaulting to 7 o'clock here, but it may be 8 o'clock by the time that the other physician comes in. Whatever you've agreed upon, that's what you can go ahead and put in here. And then that will deal with your physician handover piece. So now we can go ahead and we've done our reconciliation and we've added our admission orders, so we can go ahead and submit those orders. So you're going to notice I purposely left that one thing blank. When you get something that is a required field and it's not completed, it will bring you this little message here. So you can click on this next required field and it will automatically bring you to the box for the ECG. So we're just going to say that that's a routine ECG, and that will deal with that particular piece. And then we can go ahead and save and submit that. Enter your PIN to sign your order. And you now have entered the orders for your admission. You're going to notice there's a yellow flag here now. And when we look at the patient on the board, you're going to see there's a new TRAN here. The nurses are going to see that, and that's going to be their signal that the patient needs to be admitted. And that pretty much is the remaining piece for the admission. If you have not done so yet, then you may want to go into your document and do an admission note. And complete that admission note for your patient. Otherwise, that is the completion. That is the how you admit a patient as a provider.